I was up pretty heavy. I was up to about 317 pounds, maybe even a little heavier than that. I had seen what they could do with gastro bypass and diabetes, so I went ahead and contacted the clinic.
He was severely obese and he had the whole spectrum of the metabolic syndrome, which was poorly controlled diabetes, high cholesterol, high blood pressure, and so he was really at risk for long-term complications from all those chronic diseases. We went ahead and performed the gastric bypass. He did great, and in a fairly short time period was losing weight very rapidly.
Got my weight down to 198 pounds. Started having some problems with my gallbladder. So who would I go back to but the Cleveland Clinic?
He was in the hospital because he had had a gallbladder removal and he was wearing an insulin pump. What I do is acute stabilization of glucose in the acute care setting in the hospital.
She introduced herself and I thought it was going to be just a normal endocrinology type stop by, see how you're doing from surgery, see how your blood sugars were. She found out I was on a pump.
And in him telling me his story, I knew almost immediately that his diabetes program was wrong for him. I had got an inkling that most likely Mr. Brejek would benefit from being off of his insulin pump. So I tested him to see whether or not he could make insulin naturally. And when I saw that he could, I thought, maybe we can take him off of this insulin pump, stop the low blood sugars, and get him on the right track. And he and his wife were ecstatic the moment I brought that up. This was going to be something very radical, but I was confident that we could do it and that we should do it and that it would work.
With any chronic disease, it can't be one single intervention. You have to have a whole team of folks that are really engaged in the long-term management of the patient.
I knew that I was making a radical change in his diabetes therapy, and I wanted to be the one to follow up on that. Immediately, I thought he would be perfect for a virtual visit.
She says, why should you drive downtown all the time when you can do it right from your camper? And once you download the app, it comes up on your phone, says, hey, you got an appointment with Pam Combs at such and such a time. And next thing you know, she's there and away we go.
Well, there he is. Hey, Mr. Brejek.
How you doing, Pam?
And they were very pleased that they would have a way in which to follow up with me live, one-on-one, someone that they knew, someone that they already had an established relationship with, without even having to leave the comfort of their home. And we've been able to work things out, tweak things. The last time we talked, the Lantus dose was at 20. Are you still at 20 units?
Yeah, still 20 units.
And give him what I consider absolute quality care through this platform of virtual visits. I saw that you saw Dr. Grethauer back in June as well.
Yes, he was real happy with all the results too, so he's very happy.
It's a visit that they have with me that's dedicated time. There's no long intake process. There's no long waiting room wait. The appointments occur spot on time. I have their electronic medical record in front of me. It's very high quality, and I think patients just love the convenience of it.
And I know that we're going to get the same results because she's hearing what I've got to say and she's seeing what I got for results.
Any problems with low blood sugars?
No, the lowest I've had blood sugar wise was the other day. I actually had a 100, which was still good.
We are in the age of innovation and technology, and that is what patients want.
We have to have a long-term strategy to help manage these patients and stay on top of these conditions that require chronic management. And so the virtual visits offer that, and I think it's a great way for patients to stay engaged with their providers for the management of these chronic diseases.
I went from a pump where I was using large amounts of insulin. Now I'm down to a little trace of insulin here and there.
He's lost 32 additional pounds. His quality of life has just gone way up, and he will not be shy to tell you that.
I really feel that Pam and I have a very good rapport. She knows me, I know her. I just really feel very, very comfortable.
Seeing him so relieved, happy, healthy, and better, that's the personal gratification that I get, is so that I could come into somebody's life and make a real difference.
All right,
Good,
sweetie.
buddy. All right, my buddy. So glad you are doing well.
Yep.
Yep. Come on, I'll walk you out.
Okay.